Hi, my name is Lars Swanson. I am an internal medicine doctor. As far as how I got into it, I was sort of a circuitous route. I went to the military first. I was in the Air Force for 4 years, and when I got out of the military, I went to college. And then after that, I was doing some research in between college and graduate school, and then I decided that really research wasn't for me, so then I thought I'd take the MCAT, and next thing I know, got in medical school. That's the story. All the other specialties were, I thought, too focused, and internal medicine is so broad that it's it's not boring for sure, and that's one of the reasons I chose it. It was just because I always thought internal medicine doctors were the, extremely well educated in all of medicine. The job's very, like I said, rewarding, challenging. The people are super nice. It's nice to help people. It's a great group of people to work with at the site I've been at. Listening is important, and I would say I think I'm pretty empathetic, which is a trait that I think I'm good with. So basically, I think I have an ability to sort of feel out what patients are sort of looking for and then try to meet their need. Some people want to be told exactly what to do every step of the way. Other people have their own sort of ideas how they want to do things, and I'm willing to work with them on that. So that's sort of how I gain trust, I think, is by filling or coming up with a plan that's workable for both of us. I'm willing to work with people around what they want to achieve, because some people, they might have a medical condition and they just want to manage it depending on the stage of life they are. For example, if you're in your 80s and you have diabetes, you don't need great glycemic control, because the blood sugar control, if it's too low, can actually harm them. So, but they may read things that are telling them otherwise. So the point I mean is, for each stage of life you're in, you have to sort of approach the care from that perspective. Well, okay, I just saw a guy 2 days ago, a very nice man who presented really minimizing his symptoms. And I was like, I'll use his, I'll say his name's Bob, but it isn't. I said, Bob, you really need to have a stress test. And he was sure that it wasn't his heart. And I just got a call from the cardiologist who said, guess what? We're taking him to the cath lab right now. And I think that probably saved his life. So stories like that happen every day. I love spending time with my children. I love outdoor stuff, kayaking, hiking. Wisconsin's great for that. Really like music too.